I will verify the physician's orders. I will check the chart and assess for client allergies. I will gather all of my supplies. So I have gloves and goggles. I have an emesis basin. I have my pen light. These will be my alcohol swabs. And then I also have my NG tube and the syringe pulled back 30 milliliters with the Lopez valve off. I have a towel. I have my water-soluble lubricant. I have a rubber band and a safety pin, paper towels, and then I have 3 pieces of tape, and one has split with 2 tabs. Suction is set up at the bedside. I will go perform hand hygiene. I will identify the client by name and date of birth. I will also assess for client allergies. I will introduce myself to the patient and let them know the procedure that we will be doing. I will physically lock the bed. I will ensure that side rails are in the proper position and that the bed is at a proper working height as well. So the first thing that I will do is place the client in a high Fowler's position unless it is contraindicated for that patient. Then I would put on my gloves and goggles. I would discuss with the client a signal for them to use in order to have them tell me that they can't breathe or they're getting too uncomfortable with the procedure. I will give my emesis basin to my client, and I will also give them a cup with ice chips or a glass of water with a straw as well. I will ask the client if they have any current difficulties breathing out of either one of their nostrils. I will have them breathe out of their nostrils to assess which one has better airflow. I will also use my pen light to inspect the nares for any obstructions and just to see which one is going to be best to insert the NG tube into. I will use my alcohol swabs to clean the nostril and the nose area of the client. This will also help my tape to adhere better to the nose as well. Then I will take my NG tube and I will measure it on the client using the nose ear xiphoid measurement. And I would go from the tip of my nose to the earlobe, and then I would go down to the xiphoid process on the patient. And once I can't really hold it, but once I hit the xiphoid process, I'm going to mark that location with a piece of tape on my NG tube. I will then place my towel over top of my client's chest, and I will lubricate the end of my tube with my lubricating jelly about 3 to 4 inches. I will then have the client flex their head with their chin to their chest, and I will insert the tube into the nair. I will have the client put some ice in their mouth or have that cup with water and a straw and have them swallow as the tube is advanced into the nair in order to inhibit the gag reflex, and it will make it a little bit easier and more comfortable on the patient. So then I will, while I'm inserting the tube, I'll point it downward and backward, sort of pointing towards the ear, but I'm not forcing the tube. And if the resistance is met, I will rotate the tube. And at this point, while I'm inserting the tube, if the client has any signs of distress, like coughing, they're turning cyanotic, their oxygen saturation is very low, then I would stop the procedure immediately. I will insert the tube to the first line of the tube. Then I will take my pen light, check in the back of the client's throat to determine if it's coiling or not. If it is coiling, I will remove it or pull back on the tube in order to start over the process. And then if it has not coiled, I will continue to insert the tube. Once the tube is inserted to the tape, I will have the client speak just to make sure that it's not interfering or it hasn't been inserted into the larynx, so it will not hinder the patient's ability to talk. I will then, once it's inserted to the tape of the patient, I'm not letting go of the NG tube at this point in time, and I'm going to stabilize it to the nose utilizing that piece of split tape to attach it to the client's nose so it does not slip out. I will, once it is attached to the nose, I will assess the placement by using a 60 milliliter catheter tip syringe in order to draw up 20 to 30 milliliters of air. And I will place the stethoscope over the left upper quadrant, and I'll listen while the air is being inserted for a whooshing sound. I will then aspirate the stomach contents, and I will take note of the color and the characteristics of that stomach content as well. So at this time, I would follow any other specific agency protocol for confirmation of the placement. Some other ways that the placement of the NG tube can be confirmed is to check the aspirated stomach contents with pH paper, or you can also use an x-ray that is ordered by the primary care physician, and you can use the x-ray to determine the tube placement as well for that. So after the placement has been confirmed, I will use my remaining piece of tape to go straight across the bridge of the nose to stabilize the tube, and then I will take my rubber band, form a slip knot on the NG tube, and then put my safety pin through the rubber band and attach it to the patient's gown so that it is secure. At this time, I will provide any oral or nair care that the patient may need, and I will also measure the exposed length from the tip of the nose to the end of the tubing, because that will be important to document, and I will also mark the tube at the nostril with a marker for future reference as well. So now that this procedure has been completed and the NG tube is in place and it is secure and is in the proper location, I will remove my gloves and goggles. I will make sure that my client is in the lowest position with a locked bed. They have the call light, they have all their personal belongings. And then I will also want to make sure that the head of the bed is kept in an elevated 30-degree position at all times, just to prevent aspiration with the NG tube being present. I will wash my hands, and then I will document date and time, the procedure that was performed, the size of the NG tube, whether it was administered through the right or the left nair, the purpose of the NG tube, whether it was for feeding or whether it was for decompression. And then I will also document how the placement was confirmed, whether I administered the air and listened in the left upper quadrant, did the x-ray, or I got my pH paper and I checked the aspirated contents. I would also determine the color characteristics of the stomach contents, document those as well, and then I will also document the client's toleration of the procedure and how they handled the procedure as well.